Welcome to another edition of Health Department Roundtable. I'm your host, Chris Schultz, and with me today is our Health Director, Marty Golightly. How you doing, Marty?
I am well, sir. What's happening?
Not much. So we have, on the last few episodes, been interviewing individual members of the Board of Health. We're interrupting that now with our latest edition of Just When You Thought It Was Safe to Go Back in the Water, COVID-2, the variant. So you want to tell us what's happening with COVID these days?
Yeah, we went from almost no cases for a little over a month and some change to 4 cases active in town right now. I mean, 4 is still way better than we were earlier this year, and our vaccination rate is still really good. But 4 cases, in my opinion, is still 4 cases too many. And there is concern about the Delta variant, but the people that need to be most concerned about the Delta variant are the unvaccinated. I think it's almost over 99% of the unvaccinated are the ones who are ending up in the hospital. And the ones who are unvaccinated are the ones who are succumbing to the Delta variant. The death rate for vaccinated people is like 0.78, and significantly higher for unvaccinated. And the hospitalization rate for vaccinated people is around 1%. I mean, so statistics and science don't lie. You should really go get vaccinated. And the best treatment and or way to stop the Delta variant from moving through the population is to get vaccinated. And I also want to I know we're gonna have some more information about this next week, but I do want to touch on it just briefly, if you'll indulge me. The way we stop these variants is to stop the spread of it. If it doesn't have a host, it can't change. It can't make another variant. So if it's not infecting people, we can stop those variants from occurring too. So I know I've been plugging vaccination for what feels like a year now, but still haven't. Let me know and I'll get you one.
It works. And just to clarify some misconceptions that I've seen floating around on the internet. So if you're vaccinated, you can still get COVID, correct?
Yes. I mean, a vaccination is not, 100% prevention. Like, you can still get pregnant on birth control. You can still die in a car accident if you're wearing a seatbelt. Vaccination is a measure of protection that is up to 95% effective. You can still get COVID. You can still get measles if you have a vaccination for the measles, but it's just highly unlikely. And if you do, the outcomes are significantly better. So if you get the flu from, after you got the flu shot, the outcome from that is significantly better than you would have been if you hadn't got the shot. Same thing with COVID. The vaccination is not 100% effective because nothing really ever is, but it will prevent you from going to the hospital. It will prevent you from giving it to someone else, because we know a vaccinated person does not spread COVID-19 as easily as someone who is not. So never going to be 100% effective, because that's not how vaccines work. And we've known that for hundreds of years now. So I hope that answered your question. I think it did. But
it does. And there's been a marked reduction in testing, probably state and nationwide. But if somebody feels that they have symptoms, they should still get tested for COVID, correct?
100%. Speaking from experience. And so we're still running their mass vaccination, or their mass testing site. I don't know the days off the top of my head. I'm sorry. You can easily look those up on the internet. And if someone's having trouble getting a test, we still have access to some, or we can help people find a local place that will give them one.
I believe the Minute Clinics are doing them too.
Yes, our friends at Health Express have been doing them for some time. And I do want to emphasize that you can still get sick and it not be COVID. But I think it's smart to rule out COVID first. So if you get a cold, even if you're vaccinated, it's really beneficial to go get tested. And also that helps us with our studies, because we can know the amount of breakthrough cases we have, and we know that the efficacy of our vaccines in specific populations is really helpful. And that helps drive the science, that helps drive the data behind all these other things. And if I could mention one other thing, the Johnson & Johnson nerve problem that people are having, I just want to say that's about 140 cases and about 13 million doses. So if you're reading the articles and if you're reading the news sources on that, I just encourage everyone to read past the headlines. I know you've heard me say that before. Read past the headlines. You know, look into the data. 140 out of 13 million. If we were in Vegas, you're going to play those odds.
Bad nuts. Another concern that I think people are starting to have, and we're seeing this happen across the nation, I think LA has gone back to requiring masks in public. And I think Boston is looking at doing that in indoors. Any feel for where we're headed with mask regs?
Yeah, this is a tough one. I know that Boston schools have announced that in the fall, Boston students will be coming back in masks. And I still recommend anyone who's unvaccinated, especially, to wear a mask anytime they go in public. And I would recommend vaccinated people, if they're inside spaces where there are a lot of people, or they're singing, or they're yelling, sporting events, church, I would encourage them to wear masks regardless. Do I have a feel? If I could shake my crystal ball, it will all be dependent upon the Delta variants moving through the populations of our less vaccinated areas, and how that trickles into our area for infection rate. If you're to ask me right now, with 4 cases in town, a high level of vaccination in town, I'm fairly confident that I don't see anything changing in the near future. If you're asking me about schools, however, I think that gets a little bit more complicated because we can't vaccinate the students under 12 and under. So I would still encourage everybody to wear masks indoors. And as soon as we can vaccinate the 12 and under population, I will feel much better about telling people not to worry about wearing masks inside.
Yeah, and that looked like it's still moving forward.
Yeah, I haven't really altered my timeline in that. I'm expecting an EUA authorization, right? The emergency use authorization. I just said ATM machine, sorry. The EUA being approved at the end of September, early part of October at the latest, which means we could start vaccinating our 12 and under population mid-October, maybe, if we get access to vaccine from the state, which, as you know, has been difficult. Mm-hmm. And we'll do the same thing we did for our 12 and older students. We'll have it in the gym at the high school, or we may have it at Woodsdale or Beaverbrook if the opportunity presents itself.
Would it be a safe presumption? I mean, there's been some talk, too, about a possibility in the future of a booster shot, particularly for variants. Do you see the same sort of distribution model for that?
I would actually lean towards my experts on that one because I'm not 100% sure. Boosters are tough to predict. I didn't think we need a booster for a couple years, if I was being honest. And if you'd asked me this question a few months ago, I probably would have said as much. But if our vaccination rates stay low in certain areas, and the increased likelihood of virus being able to move around our current countermeasures, we could be looking at a booster. But since we already have a year and a half of data, I imagine that booster will come relatively quickly. Do I anticipate it by the end of this year? I just feel like that would be highly unlikely. Not off the table for the people that got, vaccinated within a year, so it started in December, our first responders and those people. I wouldn't take it completely off the table. I would just find it highly unlikely that within a year they would get a booster. It'd probably be over a year. Mm-hmm. And that's all. That could all change tomorrow based on how. That's the beautiful thing about science is if we find new information, we change our way of thinking. So if presented with different information, we will alter our course.
Makes sense. And the big takeaway from all of this seems to be, and has been from the get-go, please get vaccinated.
That's our best. That's our best way of fighting it right now. I mean, masks are great. Contact social distancing are great, but our best way to fight it right now is to get vaccinated. And then remember, all of our talking heads on TV, all of those people, most of the people in government have all gotten the vaccine. if you're hearing something and you whether you believe it or not and you want to ask questions, please call and we will do our best to explain it to you. We spend a lot of time researching and trying to stay up to date with as much of the science and much of the guidance as we possibly can, so they can have intelligent answers to questions that people may have. And I've said this a billion times. I said it a couple times here on this already. Read past the headlines and anything you read. And listen to the experts. They're experts for a reason. They go to school for 8-9 years after doctor. And that's what they do. And it's just how we get through this. I want my kids to be in school in the fall, and I'd prefer them if they didn't have a mask on. So. Yep.
I know I'm getting tickets to see Genesis this fall, and I don't want that show postponed. So let's not mess around.
I'd like to see the Celtics in the Garden.
All right. So on that note, especially getting more informed information on our next Health Department Roundtable, we're going to have our resident science guy, Tom, back to discuss some more detailed information on the variants. So if you have questions that you would like addressed, please make sure to get them into us, either through the Health Department. You can find both my email and Marty's on the website, or through Abington Cam, and we'll try to address those on the next episode. Marty, before I let you go, I'd like to plug our health department. Anything other than COVID stuff going on that you'd like to plug now? I think there's another babysitter's first aid or...
I seriously underestimated how popular the babysitter's course was going to be. We added a third in August. I want to say thank you to our library staff for allowing us to have the location. We're also still scheduling CPR courses, so if you need, somebody that needs that, I think we're going to set something up specifically for the Scouts.
I was going to mention if there are organizations or businesses in town that would like to get their people trained, should they give the health department a call and try and...
Yeah, give us a call, because we would like to host our, all of our restaurants, but over the 25 seats have to have the first aid for choking. So, we can also teach that. So, and so we have a full slate of those courses that we would like to teach. And we are having the Plymouth County Suicide Awareness. We met with Miss Jenny Babcock, and they're great. They're going to come and do a pizza night at the library, and then we're going to have a follow-up mental health first aid course for young adults, which I hope will be very beneficial to our town residents and to our parents out there. And any tool that makes the world a little better, we're going to try to get into people's hands.
Excellent. And as we get as that stuff firms up, we'll have information both here and on our health department. So.
And I do have the dates, but they're not in front of me. Sorry about that.
We'll throw something up on the Facebook page.
Yeah. So if you have any questions about the suicide prevention and mental health awareness first aid training, give me a call, and we'll key in on that.
Awesome. Well, Marty, thank you for taking time out of your Saturday morning to join us.
My pleasure.
This update. Remind people out there to be safe, get vaccinated if you haven't, and if you have questions, please reach out to our health department. Everybody here is here to help and looks forward to answering questions. So thank you, AbCam, and we will see everybody on our next episode. Take care.